enrollment simplicity, price comparison, all those same kinds of things that we value in other parts of the consumer experience to health insurance. That's essentially what it is. And if you look at data around consumer perceptions around health insurance, whether it's the stuff we did in Massachusetts, or the Pew data, or Kaiser, or RWJ, which is Robert Wood Johnson, you find a very consistent thing, which is in general, consumers find buying health insurance to be confusing, complicating, overly expensive, and they all think they're getting screwed somewhere. They don't know where. They don't know if it's the insurance companies, the brokers, where it is, the doctors, but they just can't believe something should be this expensive. And you can't blame them. I mean, if you look at the data in our state, 2009 was the first time where the average family premium exceeded the average family mortgage. The only difference is the average family mortgage doesn't go up 8 to 10% a year. So these are all the kinds of dynamics that are impacting people's frustrations around health insurance. So these are all very standard. Is the insurance exchange going to solve all that? Absolutely not. Does the Affordable Care Act solve that? No. It makes some dents, particularly in the migration from fee-for-service reimbursement to global payments and other types of paying for outcomes. And that's a big part of one title of the Act, which is Title III. There's a New York Times story coming out tomorrow that's actually documenting the impact of some of that on lower costs. Because we've had the lowest actual inflation in overall healthcare costs in the past 3 years that we've had in decades. So anyway, that's all some of the dynamics around it. So there's basically, the part of the goal, however, as I said, was pro-competition, is to try to get more players into the market. And in our state, beginning in 2014, is the first time we have a new not-for-profit entrant in our market in 26 years. And that's a company called Healthy CT, which is an insurance co-op created by the Connecticut Medical Society. And it's funded by the federal government. But that's going to be a new entrant on the exchange and in the market. In 2015, we're having a big not-for-profit from Massachusetts named Harvard Pilgrim come into our state. So, you know, so health reform is good in this regard. It's not a perfect law by any means. But to the extent that it brings more health plans into our market and they compete more aggressively for your business, that is a good thing. I firmly believe, and my experience both in Massachusetts and California has borne this out, that the more competition that you have in anything, be it health insurance or anything, it's best for the consumer. And so we want more health plans to come into our state. We want them to get into the marketplace. We want them to fight it out for your business. And that's the best way, in our experience, to have more competitive prices for you. So, it's finally, exchanges are brand busters. Traditionally, if you look at this historically, the institutions that have been the most resistant to healthcare reform have been the insurance companies with the biggest market share. Because, you know, everybody likes to talk about the free market and pro-competition and everything. But in fact, actually, nobody really likes competition. Monopolies are really a lot better. So this is true in insurance as well as any other part of the market. And that, again, gets the reason that we want to have an environment which is conducive to more competition. You want to take a seat? Okay. So there are three kinds of insurance exchanges. And matter of fact, this gives you a little bit of insight. The exchange word now in Washington is now a bad word. They don't like that word, and it's for political reasons. We're now called marketplaces. So the E word is now verboten. Now we're called state-based marketplaces. But there's three kinds. There's one is a state-based,